Hi, everyone. Welcome to today's webinar on fertility preservation and all your options. This is a really important webinar, just because I think it's a discussion that almost no one talks about. And I think unless you've gone through the process yourself of trying to have a baby or going through the process and going, I wish I had known this information early on, my chances would have been better. Um, or just for your grandchild or your daughter or your friends or your sister, it impacts every one of us. And so this is a discussion that just whether you have children around, it's not just for you, it's for to get spread the word. And so I'm really happy to have two of my friends here, Dr. Mari Mitrani and Yessica Fernandez Cruz. um, Yessica has gone through the process herself, so she'll be able to give us and share information of her journey and her thought process and the process of how she got to the point of actually going through the procedures and the questions that she learned along the way, and she'll share that with you. And then Dr. Matrani, a physician scientist, she'll give you the science on it and also just the understanding from a scientific and biological perspective of how we as women should think about this process. And with the world changing and becoming more modernized per se, we're gonna live a lot longer. And so because the world is changing, our thoughts about raising a family and when to have children starts to get pushed further out. And so for that reason, this is the type of conversation we want to be able to start having, especially with our daughters and people that we really care about. And so before we get started, I just want to read a really quick disclaimer, and then we can jump off into the discussion. The information shared in this webinar is for educational and informational purposes only and should not be considered medical advice, diagnosis, or treatment. While our panelists bring expertise in fertility, reproductive health, and wellness, this discussion does not establish a doctor-patient or client-coach relationship. We encourage you to consult with your healthcare provider or qualified medical professional for personalized advice regarding your health and fertility options. The views expressed by the speakers are their own and may not reflect the opinions of all medical or wellness professionals. By participating in this webinar, you acknowledge that the hosts, speakers, and associated entities are not responsible for any decisions made based on the information presented. Thank you for joining us, and we're excited to share this important conversation with you. All right, great. And so just a reminder, we have a Q&A box. Please put all your questions in that Q&A box. And at the end, towards the end, we'll start asking those questions and we'll start discussing around those questions because I'm sure you'll start having questions when we start the discussion. All right. And so why don't we just kick it off with Yessica making an introduction about herself and her background, and then we'll have Dr. Mari Matrani also make an introduction of your background and what you'll be sharing today as well. Thank you.
Hi guys. Well, thank you so much for having me. Thank you, Yemi, for organizing these great webinars that I think are very valuable for women. I hope all the women here enjoy today. It's an honor for me to be with you and with Dr. Mitrani as well. And well, about me a little bit, I have been for many years working in the longevity field in biotech and also for family reasons. I work for a foundation that is devoted to the prevention of chronic diseases and aging. I have been involved in such a way that I have then taken my own path into this field towards stress, which is my main focus right now, trying to help people relax a little and be more in tune with their lives, more connected with everything around them, so that we also take care of our health by doing so. And I guess just to start without starting completely, it has a little bit to do with the fact that I've been in this field for so many years that I came across this idea of freezing my eggs, but that's for later. So pleasure to be here. Thank you guys.
Yessica and Dr. Matrani.
Yes, thank you again, Yembi, for having us. Very interesting topic. A physician scientist, as you said. And First of all, I'm a woman. I am a mother. I am a daughter, and always very, very interested on women's health. I devoted 17 years plus in the study of stem cells and the research and the development of specific drugs from stem cells to help different kinds of scenarios. And lately, in the last 2 years, I've been like really focused and open a laboratory about the genetic side of the embryos once they are fertilized. So Yessica was saying she was able to freeze her eggs, but once they get fertilized, then this kind of laboratory that I built can actually look at the chromosomes inside or the DNA inside of this fertilized eggs and help the physician make the decision which of those embryos it's better to transplant in what order. So it's even though I've been in medicine, even though I'm very interested about women's health, when I stepped into the fertility world, I discovered that we don't know so much, and it's time for us to start having these conversations. And as you said, many of you might not be fertile anymore. Many of you have already passed that scenario, but you have nieces, you have granddaughters, you have grandsons, you have sons and daughters that will come up. And the way that we are shaping this world right now, we have to make decisions and clear decisions. And us as female matriarchs or the females that are in charge of educating our youth, we have to start voicing it out.
That's right. That's great. Yep. And again, it's we think it's just a female situation, but it's not. It's men as well because they our husbands, our significant others, they go through the hardship and the process of the whole, of the whole journey of trying to conceive, of raising a family. And so it's not just women should be aware and then we're dragging men along, or if our sons are aware of it as well, they're more insightful with their partner as well in having that conversation and being more accepting of the process and being ready for the process as well, right? And so just to kick it off, I'll give um the panel to Yessica to just kind of share her story of what age and what did you know at what age and what point did you say, hey, this is an idea, and I should do this, and how long did that process take? And Dr. Mitrani, please jump in if you have questions. This is an open discussion between the three of us, and so I want this to be a dialogue more than just a presentation, but if there is a question that just kind of jumps out at you, just please, that could help the audience, please just ask it, and then we'll just converse from there.
Great. Well, so I had been very familiar with the field of IVF and fertility and all of that because when I worked in biotech, I worked with the field of telomeres. And there was a project that we started here in Spain, which was actually already started when I started working at the company, with an institution that is called EVI in Spain, which is in Valencia. And it at the time, I started in 2012, so probably the relationship with them began in 2011. This institution was a pioneer in fertility in the world. They had been discovering all kinds of things. It was a reference institution. Everybody in Europe came here to that institution to do their IVF processes and so on. Now, you have to think at that time I was, 28 or something? I don't know how to count, so it was somewhere around that age. And so I wasn't thinking about that. I wasn't even like worried about it. But I was working with them and learning about how it works. Then I had the opportunity, because we had the project with them, to go to Colombia and work with an IVF clinic in Colombia as well. So just to give you an idea, I knew what this was because I was hearing about it. I was involved in how does this process work and all of that to see where we could fit in and so on. But for me, it was something you did if you had infertility problems. That was like the only thing that I understood there because I wasn't even thinking about freezing eggs or anything like that. But later, I had a friend whose husband had cancer. And so he needed to freeze his semen to make sure, he was going to go through his chemotherapy. So she decided to freeze her eggs as well, even though they were super young. But it came because that conversations came up, then they both decided to do the same thing. And looking back, I'm jealous because she did it super young, right? She was like 31, I think, or something when they did it. So she had like 20 eggs frozen. And but again, I was like, oh, interesting. Well, but that was like the first time that the question popped up, like, should I freeze my eggs? But I was in my 30s. It's fine, young, it's okay. I got pregnant at 35, and that's a very long story I'm not going to share, but that whole relationship went down. I lost the baby. It was my first experience at potentially becoming a mom. And so that shifted everything because my relationship ended and I saw myself with the idea of actually I would want to be a mom. And I don't have a partner. I don't want to be a single mom. But what if I find a partner in 4 years from now or 5 years from now? Then the question started. And I had a very good friend who was freezing her eggs at the time. Again, I didn't do it. I waited to be sure. She did it. And so then at 38, I think I really felt the clock ticking. And I thought it's time. Now, if you want to do it, you do it now. You cannot wait any longer. And so I right away in that moment went to that Valencian Institute that I knew because I had worked with them in the past. I knew that they were a reference, even though there were now new institutions that were as good as that one and maybe even more innovative in some areas. But that one was good enough for me to be sure I was in the right place. And then I went ahead and did it.
And you
Looking
said at
back, could
38.
have done it at 31.
But I asked a question to Dr. Mitrani on this is, the difference between 31 and 38 and in your 20s, for example, we know that like age plays a very important role in this process. Could you give us a little bit about the science and the science around
Absolutely.
but everybody understands how important it is?
Yes, and you use a very well used term. My clock is ticking, but people don't understand what actually clock is ticking means. And since I've been in this field, now I really understand what that is. And it's not that you're aging, but it is the DNA that's inside of your cells. So moms bring in half set of the chromosomes, dads give the other half set. And that's how we make one full set of 46, right? So women and men, as we age, our chromosomes start declining or preserving the amount of chromosomes that you will give out. Those 23 chromosomes that are inside of your egg or they're inside of your sperm start declining. The quality of them start declining. So when you say the clock is ticking, it's 100% related to the chromosome count. And that is why after 35, we start calling pregnancies, I don't know if you've heard the term, but geriatric pregnancies. As a woman of 35 in today's day, at 35, you're just starting to peak in your career as a woman. You're understanding who you are. You're just coming out of your shell. And that somebody calls you geriatric, like you are like really, really old, right? But it's determined because of this, like the amount of chromosomes are just not produced the same. And what Yessica also said is like her friend at 31 was able to collect 20 eggs, which is kind of where it's a sweet spot. Eggs will then have to be fertilized, so less will be fertilized. And from those fertilized eggs, then we count the chromosomes to see which ones are euploid, we called it. They all have 46 chromosomes, and they have a viable baby at the end. So your chances of having a healthy baby from 20 start going down. There's a mathematical curve, right? So by the time she decided at 35, okay, I think I have to, she's already in that curve where more miscarriages happen and more DNA damage there is. And that's why more miscarriages happen. So your time is clicking, or your biological time is clicking, is 100% related to the chromosomes that are inside of either the egg or the sperm. And I do want to remind everybody, it's not only about women getting pregnant, men and the sperm quality right now, more and more are changing. And sometimes we always want to blame it in women and the women's possibility and the healthiness of them and the stress related and how healthy they are. But 50%, very close to 50% of the time is a male infertility as well. So that is why I'm saying it's important, if you have sons or grandsons, to start talking about this conversation, especially related to our environmental problems right now.
That's right.
And that is what, even though women are deciding to have kids later in life, we're still seeing, and male, before male sperm was very healthy up to very old. Now we're seeing more and more problems with younger sperm because of the environmental factors. So there's a lot of endocrine, we'll get this in the next questions, but it's time to have these conversations more often.
And more so, if it's 50%, that opens up for another webinar to discuss about this with our
Yes.
sons and husbands and significant others as well, right? Because it's because just having this awareness is only a third of the conversation, not even half of the conversation is the awareness, right? Maybe a quarter of the conversation. And so you brought up a couple of really great points. And so when we're talking about aging, right? It's not necessarily the number of eggs per se, but like you said, it's the quality of the chromosomes within the eggs itself that starts to that becomes more high risk to have an unhealthy baby, right? And so the sooner that you have you can and start the process, the sooner you'll have healthier eggs for later on. Okay, that's a great option and understanding of this process. Now, what would you say, Dr. Mitrani, would be that the ideal age for women to start taking action, or to start moving towards this type of procedure?
So unfortunately, in today's day, as Jessica said, it was not because uh, there was a close friend that had that conversation, we're going to have cancer, we're going to freeze. Now she became aware, right? But if she didn't have that friend, she would have not known, right? So the more we can do to start talking to women in their 20s, as I always say it's like having a saving account or having a stock market account, that you have your money in the stock market, you're not touching it, or in your saving account, you're not touching it, because the healthier eggs are always going to be closer to your 30s. So in your 20s, it would be ideal, right? In your early 30s, it would be great. If you wait to 35, 38, then the amount, the quantity, and overall the quality of those eggs and sperm as well will starts declining, right? And if you need them, you can use them. If you don't need them, it's totally okay. You decide what you are going to do at the end of the day with those. There's this new trend where women are understanding that this is a priority, and they're asking their parents as a college graduation gift.
Interesting.
Instead of doing something else, give me the money so I can preserve my eggs. Because why? Now we are, as a woman that has been an entrepreneur, that has pursued an MD, PhD, OMD, I've studied so many years into my late 20s to then try to start building my career and my companies. And that brings us already to later in the 35s, 38s, when we are like, okay, I think I'm comfortable right now. And at that point, to start realizing that, oh, wait, I might want to be a mom one day. It's the woman can carry if we're healthy, if we're taking care of ourselves, if we're aging correctly, the female body can carry pregnancies until later in life. So it is not the ability of carrying the baby right? Yes, there are risks. I'm not going to say no, it's not risky. Yes, there are risks associated, but the problem is that your eggs are not as healthy chromosomally. So there will be more, and why there are more miscarriages? Because they're not compatible with life. They're genetic problems that are not compatible with life. And that's why we see a lot of miscarriages. So, again, the best time, there's this incredible REI, Natalie Crawford, Dr. Natalie Crawford. If anybody is interested, please look at her. She has beautiful podcasts, YouTubes, and she explains everything so digestible. She was also infertile, being an REI, a reproductive endocrinologist, infertile specialist, right? So, and she's making these big waves of how to educate us all better. But she says the best time to collect the eggs is the moment you say, should I?
Hmm.
Good point.
I love
Yeah,
that.
very good. Very good. And just to kind of go into you know, the longevity of our life and the ability to carry a child, for example, right? Um, with science and research now and technology, we'll probably live at minimum 100 and on right now. Like that's the goal of so many doctors and scientists, and that's why we have the world of longevity right now, right? And so it's very probable that we'll get to that point or close to it. And as women, as we get closer to it, again, you know, our lifestyle starts to move that, you know, further out in family planning because we want to build this empire. We want a certain lifestyle before we start having children. And we picture this beautiful life with children in it. And so those things have to be in place for us to bring this child into the world, right? And so with that regards, could you just touch on a little bit of the science behind our body on carrying a child? Well, you know, if I did everything right, meaning that in my late 20s or mid 20s, I froze my eggs. And then now, because I want to touch on this, a friend of mine said, oh, a friend of hers actually did, you know, froze her eggs and then she had a baby at 50 without any problems whatsoever because she was ready to carry a child. She was ready to have that life with a child. And, you know, and again, with science and research and hormone therapy and all this stuff, you know, it allows us to have the energy and all this stuff to also sustain a certain lifestyle. And so could you kind of explain on the science and the physiology and the biology around carrying a child much later on in life?
Yeah, and that's very interesting. As I said before, our bodies are able to carry a pregnancy if we're healthy enough, if we still have cycles, right? Where we can actually, our body is still in that fertile window. A lot of women are going into menopause at 53, 55, for example. And I have to throw this one. Last year, there's a woman in Africa that had twins at 79. So she was able to carry, those were not her eggs, not daddy's sperm, but her body was able to deliver twins at 79. So biologically and physiologically, if we are healthy and we're inside of our fertile window, we still can carry those pregnancies. The problem again is the egg and the sperm fertile enough, good enough, chromosomically healthy enough to be able to, you know, the womb is will carry it. Our biology and physiology as women will do that job. I'm not saying it is not without a risk. Yes, the older we have kids, the older we are pregnant, it does come with more and more risks, but it's doable and more pregnancies are happening that way. Also for the women that never you know, if we have women here or if you're listening to this and you never collected your eggs but you're still under your fertile window, there's donation of eggs that you can pick, there's donation of sperm that you can pick from. So there are so many different ways right now that if you want to carry your child, there's so many other options out there. It is a matter of starting to talk to REI physicians and not waiting for you to know that you're infertile or not. And always just have this one conversation and see what else can I do to adequate my fertility towards the future that I want. And it's just that one conversation with a doctor.
Oh, great, thank you. And Jessica, kind of
Mm.
switching the path a little bit from the science, but more so the journey and the me, right? My feelings going through this process. Could you kind of give your journey of the process of the extraction and you sign the papers? Like what does that process look like?
Of course. But I wanted to add just one thing before I go into that, because with that, the thing that I find the challenge here, it was for me, if you had asked me to do it earlier, was that I wasn't sure if I wanted to have kids. And I think that when you're young, you don't know this answer very quick. Some women do. I mean, I have friends who were born to be a mom and they knew it at 5 years old. I'm going to be a mom. I was not that kid. I didn't care. I'll be very honest. I didn't care if I had or didn't have kids. It was later when this whole situation became familiar, when I was close to it, that I understood I did want it. Now, I would say if we can teach our women, the girls, the younger generations, to just, you don't know what you're going to want in 10 years from now. And this is the old wisdom talking.
Yeah.
And it's the truth. When you're older, you change your mind throughout your life so many times that this is something that it doesn't matter what you want now, but you're going to regret it very much if you change your mind. That's like, for me, the point. If there's mothers, aunts,
Yeah.
sisters here listening, probably the answer you get back is, oh, mom, I don't need that. I never want to have kids, right? That might be and then it's fine. But know that it is, I think that was the thing for me that made me postpone it and postpone it. I would have done it at 31 had I wanted to have kids, if I had known for sure that that was my dream. So I think there's that part of it as well, that in the different stages of life, we don't see the reality of what we really want until we're in front of it. So, and insurance, like Dr. Mitrani said, right? You
100%.
might use it, you might not, but you invest in it for your own.
Yeah. And I think that's one of those things where you just can't go back, right? You just
You
can't go.
can't.
And it's better
Yeah.
to have that insurance. That's, I don't like insurance, but that's the one insurance that
Yes.
I'll pay for, you know. And so definitely um that's a good point. And it's because I do know very young females that are like, we don't want to have kids. We decided we don't want to have kids, right? And they're really happy. And I remember I was that person with my husband. We had the best life. We surfed, we came home, we barbecued, we took a nap, and it wasn't until we started talking, because we had so much love to give. We were like, okay, we can't just love our dogs anymore, right? And so and then my husband's mom had cancer, and then we said, you know what, if we're eventually going to have children, then we need to do it now. And I'm very lucky in that sense, because my lifestyle would have just kept pushing me further to having children, right? Because I was already 33, and we were like, oh, a couple more years, and then guess what? I'm here going through menopause at 44, 45. If I had waited and I kept pushing because of career and everything else, I probably would have a very, very difficult time, conceiving right now. And so to that point is like, you just never know what the future holds or what your mindset's going to be like. Because today it's not exactly the same as what the future is going to be. So just kind
And
of,
another point, just picking back from that, is most of the women that actually decide to and come to that conclusion that you did at that age that you did, which was 33, right? You're having your kid at 34, right? They're growing 35, 36. You're ready to have a second child. And at that point, secondary infertility is really, really high. We don't talk about that. Is that infertility that happens from the first pregnancy that was in your later 30s, and the cutoff is that 35. It's not that you wake up at 35 and you don't have any more good eggs, but we see that spike of more chromosomal defects, more miscarriages, and that is it's so cruel, because some families and some women are ready to now continue fulfilling their family dream, which is having two or having three. So if you never froze your eggs before, you have that one kid, but you wish you had more and you cannot get pregnant for anything, and the quality of your eggs have declined so drastically that you can't have any more of your own. Or as Jessica is going to share with us, how does the process of collecting those eggs are, right? It's a very, very tenacious process.
Hmm. Yes.
Okay, I'll jump into it then. So, I mean, I have to say, I went into it without knowing a lot how it was going to feel. I didn't know the process because I had seen it in my friends, so it wasn't like I didn't know how long it was going to take and all that. But I did see it very different. One friend was fine, the other one was almost in a cave because she couldn't stand the hormones. So I was like, oh, let's see what happens to me. So that was a little bit the scary part. So what I did to make sure that it was going to be easy, I made sure that that month I wasn't going to do very important things. It was like, okay, this is my month for this, so I'm going to take it easy. And it's not really a long process, thank God. It's pretty simple from the moment that you start. Well, first of course, you have to go to the clinic. We decide on the date. They look at you. They say, okay, this is your fertile window. This is what we're going to do. We have to look at your ovulation. And then the day starts when you have to start doing the hormone injections. And that's about 2 weeks, more or less, that you're doing that, and they're monitoring you because they want to stimulate the eggs. So once that is happening, then you're monitoring yourself so that they can see what is the best time to retrieve the eggs. And for me, it has been the 2 weeks because I did it twice. The first time was simple. I have to say I wasn't really affected by the hormones. It was fine. I mean, a little bit, but we women know hormones, so it's not that scary. I think if a man had to go through this, it would be very different. But it really is like, having the hormonal feeling that you have during your period or something like that. For me, it was reasonable. As I say, my friend had a harder time than I did with that. And then basically they set the date for the retrieval whenever the doctor decides you're being monitored. So then they see, okay, it's time to extract. And then you set the date. And that day you have to count that as you're not going to do a lot that day because after, it's like a 30-minute process. It's pretty easy. It's not a surgery or anything like very invasive in that sense that you're going to have wounding but you have some bleeding afterwards when you get home. Maybe the next 3 days you're a little bit uncomfortable, and then it's done basically. So in simple terms, it's an easy process, but it really depends. The second time I did it, I did have a different feeling with the hormones. And it was, I guess, because when you're doing it a second time, it all feels heavier. I don't know how to describe it. The injections, it's a lot of injections. There you're sitting doing this, and a lot of things go through your mind. I think that also, I want to bring up the challenge, the mental challenge here as a woman, where you're feeling like, to me, first of all, it made me understand what women in fertility processes were going through, because I could only imagine if you have to do this over and over again many times, and with the fear of not getting pregnant. Like for me, that was like, this is hard for me, and I have nothing to lose right now. I'm just doing this for as an insurance, so to say. But it was like a realization of, wow, this journey is hard. It's a tough journey. And then, as I say, the second time, the hormonal feelings were more like, I felt very aggressive. I was angry all the time. Like I really wanted to hide that week. I was like, I don't want to see anyone because I'm so rude to myself. I don't know what I'm going to do to others. And so that was like a more difficult one. But again, for me, that I have to say as well, I have never done it alone. I had my parents, I had 3 best friends with me. It was in the middle of COVID. My dad couldn't pick me up. My best friend came with flowers, and I felt like a
Oh,
princess. So I think the support system
the
makes a big
community.
difference as well,
Yeah.
that you have, right? Like these are things that yeah, you're okay, but you're vulnerable. It's a
Yeah.
very vulnerable moment.
Yeah.
Um,
I think mentally that is it is a big taxing thing. And as you're saying, you were doing it because you wanted to, but a lot of the experiences, 80% of the time, the women that are doing it, it's because they've already, so to be diagnosed as infertile, you have to be trying for 1 year without protection to then become like have the diagnostic, right? So imagine you have 1 year of complete frustration every month, and then to go to the doctor and they run all the panels and they say, yeah, you definitely have your hormones are not well, you are infertile. That diagnosis has been it signifies like if somebody would is like a grieving kind of mental taxing. That's how they have evaluated when you receive that diagnosis of being infertile, as if somebody died. That is how hard and taxing it is emotionally. It is great that you didn't go through a lot, but if on top of that you have to do injections every day, which if you're a healthcare provider and you've been surrounded with needles and you know what that is one thing, but most of the people they don't know what it is. It's time to give yourself an injection, and here we go again, and then again, and then the other thing that I would like to explain, because I think that's something I didn't even know, is when the doctors are giving you these hormones, what we're trying to do is stimulate the whole. So we know that every month one follicle comes out, right? But we never were told or educated that it is a whole pool of eggs that move towards the to the side. They're maturing all in a bunch, right? And it's all of those that, because of the hormonal stimuli that we give, we want all of them to grow as much as if naturally is one that gets picked and is the one that gets going to the fallopian tube. So what we do is with all of that hormonal stimuli, we stimulate all of that bunch. So they all come to the side, and that is when we collect all of that bunch. So you have that pool. The younger you are, the more amount of eggs that get pulled into that bunch. So that is interesting because sometimes people think it's just like, how am I going to collect one? But how did you collect 20? Like, it's like, it's good to always know, I think.
And ideally, how many, you know, um, like what's an average of, if let's say if you were in your 20s, what's an average of collection versus if as you get older, what would that number look like and how fast does it diminish in a sense?
I think the sweet spot is 18 to 25. That is always when you're younger. Um, because I am in this industry now only 2 years. I went to one of my friends and I was like, let me check my AMH. Let me check I want to know. I'm 40, I'm about to be 45. And she looked at my eggs and she's like, "Oh, there's only four in this side and only three on that side." So yeah, like it matches your age right now. Like this is where you are supposed to be in your age. If we do all the stimulation, I don't think we can get more than eight. So imagine at 44. So that is a big spread. And when I was telling you, even when you collect 20, just to put that number of 20, all of those 20 then have to be fertilized, but not all of them are so healthy to be fertilized. So from those, they cut into four or five. Four or five fertilized eggs also have to be checked chromosomically to see if they are euploid, meaning that they have the amount of chromosomes. That is as a common practice here in the United States. In Europe, is not a common practice. Is more the embryologist that looks at the morphology, meaning how do they look, like how cute they look, and they get a grading. And those are the ones that the doctors pick. But here in the US, we do have this common practice more and more to check for the chromosomes of that fertilized egg. So know that at the end, and there's an astronaut right now in social media. If you are in social media, Kelly, I think it's Kelly Gary, her last name Gary, but she shared her journey. She has secondary infertility, and you know, finally she got implanted that last one. She only had one euploid embryo, and she's finally pregnant. I think the whole community, we've been like following the journey so much,
Uh-huh.
and it's just she opened her platform to be so ready to, just be so vulnerable in a moment that is so hard and for everybody to see. And I think more and more we have to do this because there's so many women, so many men that are going through this
Mhm.
really hard experience. And to give you the numbers and the stats, because I'm a scientist, we're saying that 1 in 5 female or married couples are infertile in the United States. 1 in 6 married couples worldwide are infertile. So when you see those numbers, that's a lot of people being infertile, and we're not talking about it.
Right. That is a big number. Very big. Um, so if we look at the process itself, right? And how do we find the right clinic? What questions do we ask? Right. And I'll open this up to both yourself and Yessica as well. It's like, Yessica, you had the experience since you worked with this clinic already, but what are the right questions to ask to, say this is the right one for me? Like not just from the clinic itself, but from my life itself, right? Like
Mhm.
and so there's a lot of things to think about, and there's a lot of things that we don't even think about to ask. And so what are those questions? Just so people are aware.
Mhm. Well, I mean, I'll take it from my experience. I'm sure Dr. Mitrani will have much better scientific insight to make this decision. But um, well, first of all, of course, you have to see what you can pay. I mean, that's clear. If we don't have the money, then maybe the number one clinic is not an option for us because we cannot afford it. And that's okay. I mean, I would say it's fine. There are good clinics out there. If it's not the number one, the number three will be fine too. And I've seen that. That's why I say my friend who just had a baby as a single mom from her frozen eggs at 35, and all her eggs are embryos, so it's wonderful. She she did it in a much cheaper clinic because she didn't have the money to pay for the one that I went to, but it was a good clinic. And the thing was criteria that because I helped her find out if that was good enough or not. For me, it's really to know who works there, who are the people in charge, what's behind these people. Are these people who have been doing this for a while? Do they know what they're doing, or is this someone who just got into this field and is starting now? For me, in medicine in general, the thing that is my criteria to choose any doctor is always to look at their history in the sense of have they done any kind of research? Have they been pioneers in anything specific related to the subject that I want to be treated in or whatever I need? It's more all of that than is the clinic great? Is the service great? I don't care so much about the service as much as the quality of the science, because that's why I'm looking for a doctor or a clinic. Other people need a very nice service and they're very upset when it's not. For me, that's not the key thing. I want the science to be good. I want to make sure that the people who freeze my eggs are experts in freezing eggs. The people who unfreeze my eggs are also the guys that know what they're doing in the lab. The lab is also important here in this aspect when we're talking about freezing eggs. So we need to make sure that at least, I would say if you're a lay person that has nothing to do with the medical world, you know nothing, try to find someone who does and help you out to figure this out, because I think that they can do deeper research for you than just go on social media, look at what's the number one, in top clinics in Vogue magazine or things like that. You always have two sides to that, but that's my perspective. I love to hear Dr. Mitrani. What do you think?
I'm with you, Jessica. I mean, I really think what as a doctor, a physician, as a woman, I would say in the United States, I look for board certified REI. So the doctors that, yes, they're OBGYNs, but they're specialized in reproductive medicine, that they are part of the American Association of Reproductive Medicine, that they are board certified, meaning that they have passed the boards on REI. That is a subspecialty of after you've done the OBGYN. So, and you said, have they done research? It's part of the curriculum as an REI fellow to do research. So these are physicians that have dedicated their life, sweat, tears, blood into this specialty. These are, I've never seen a community of physicians and healthcare providers in a community like this that is so dedicated to their patients. And then for me, I think the other thing that I would look for is, does my doctor, when I am in that interview with a doctor that, okay, the doctor is qualified, uh, does he or she understand my needs? Are they putting me off? Are they rushing me to get to the next patient? Do I need that? Maybe you were saying I don't need the service, but am I getting all my answers to the questions that I had? And how do I feel? How does my body feel? I go a lot from the gut feeling, from the what is my heart saying to myself? Am I going to be, because you kind of marrying this physician or these healthcare providers, the nurses, the NPs, the RNs that are in this clinic for this period of time that's going to be very taxing and challenging. So when you're in your lowest, will they pick up the phone, right? I think those are very important. You did mention the laboratory. So physicians do the physician job, but then there are the embryologists. The embryologists are the ones in charge. Once the doctor collects the eggs, they give it to the embryologists. They are the ones in the laboratory, cleaning the egg from that little soup that they're at, and then it's beautiful. Social media has a lot of information, and you can really look at this. There's so many incredible embryologists out there doing advocating, and then they're freezing them and then unfreezing them. Right, a lot of problems can happen there. Yeah, I mean, I think asking the physician or the practice, who's your embryologist? Are you going to keep my eggs here? Are they going to a centralized area? Those things are very important. But I love what you said. Maybe look for a friend of yours that has more knowledge in the subject, and let them guide you if you know nothing about the subject.
And so is the physician that does the extraction normally the same physician that do the IVF, for example, like later on? Like let's say today I'm in my 20s or 30, I go to this clinic, I have it frozen. Is that the same doctor? Does he have the same talent or skill set to do the implant of it, for example?
That is a great question, because yes, so that is another thing, right? I have a lot of, I'm from Ecuador, so Latin America. A lot of my friends will go back to Latin America to freeze their eggs because it's way cheaper, right? But I always tell them, if that's where you're freezing the eggs, that's where you're going back to do the IVF procedure. Yes, most of the time these eggs stay in the same facility where the doctors are. So that is the doctor that will, fertilize if you didn't fertilize, because you have the option of just collecting your eggs, but you also have the option of, if you are married, fertilize those. If you are not ready to fertilize, even though you're married, you can always keep your eggs. Listen to that heart feeling, because what if you fertilize all of your eggs with that person that probably is not the correct person, that in your heart is not the correct person? Keep some of them not fertilized. And I'm throwing a lot of things here, but yes, that physician that collects the eggs most likely will be the one that ends up fertilizing, and then deciding which of those, from how they look and from their chromosomal interpretation, which of them in which rank they will implant first, second, and third. Now we only implant one embryo at a time because the chances are better for mom and the baby through a pregnancy.
And so it's not just thinking about today. You kind of have to think about the whole entire spectrum of this, right? Meaning that once I choose this clinic and I choose this physician, I really have to choose this physician for the future as well, because it's, and so that's what we should look at when we're looking at a clinic and the physician and the team. It's not, is he the best extractor, right? It's like so and so it's looking at it like, what's the success rate with implantation, only because your probability, especially if you do it young, is much higher, and it gives him the higher chance of helping, So for example, like what is that variance in regards to, let's say I go to like a cheaper clinic and maybe cost isn't truly correlated to the quality of the physician as much, I don't know. And that could be a great question as well. But let's say I pick one that it just happens to be down the street, right? And I was like, just get it out of me, I have this insurance now, but he's not the best doctor for, he doesn't have the best result. What's that chance? What's that gap? What does that look like? Like, because I did it early, is his chances, how much more of a chance does he have in regards to my success when I go back to this one doctor?
Yeah, so infertility, the world of infertility, there's so many unknowns. And that is something I hope everybody carries with them. Even with the technology of 2025, with the hormone levels, sonograms to implant, sonograms to collect, the best embryologists, and having healthy, perfect embryo, the chances of that embryo, you know, staying in that womb are, we still don't know. The medical and scientific community still does not know what makes a pregnancy successful or not. It's just the chances of luck. Still, until today, we're January, February 2025, right? And I have a dear friend of mine in LA, has a lot of money and was able to get the number one clinic on the list, as you just said, the Vogue clinic number one list. She went there, met with the doctor, and as the process was going, she said, I felt like I was like another cow in the milking farm. She said it was not a caring process, and it didn't go well. My eggs were not collected correctly, so I had to go to another cycle. And I decided, she said, I decided to look for another clinic. She said, I went, let's just say, to the clinic down the street. It was a single owned physician that owned that clinic, but the connection, the interaction was so much better. They changed the program of hormones, because hormones can be dosed in different ways, right? So they changed that. Now she collected 25 eggs. She is so much happier with that. So again, I think it has to be that connection that you have with a physician, with the whole team. I think that is very, very important, because it is your long term. You're kind of getting married to them and to that practice. Yeah, and unfortunately, all of this can cost from 15 to 30,000 each cycle. In the US, medication is not even counted in that. And if you need 2, 3 cycles, there's people that, you know, try to get a second mortgage for this procedure, and you're still not guaranteed that it's going to happen. So it's a lot to think about. It's very, very hard.
What's the price in Europe? I know it's less expensive in
No,
Europe.
it's much less expensive. We're talking $2,500 per cycle.
Including the medication?
No, the medication sex, that would be
Oh,
3,000, about 3,000 euros, more or less. 3,400 more, it would be the.
So
yeah.
the
So
so the price is 10 times more in the US, at least, is approximately 10 times more than in Europe. And so, if I'm not pushing anyone in any direction or anything like that,
And let me just
I'm just
add
saying
one more
South
thing. We
America.
have IVF
and
included until you're 40. You can go to the Social Security and you get it paid for. You can do a free IVF, so to say,
That's
until
amazing.
you're 40, which I also find very interesting. At 40, you're no longer eligible.
Yeah, because your chances, I guess, at that point,
I
there's
know, but
so
what
many.
I mean is that should not be a number. We don't know. It's each woman we should see. Are you eligible or not? And I think it's interesting that that's a government decision that we put it at 40. And I think, well, maybe we need to consider the
yeah,
woman before the age, right?
Always. In the
Right.
same Latin America, also, I think around those prices, 2,500 to 5,000, and there are great physicians also in Latin America that are doing the job. But you know, then it's adding that plane ride. And you were saying, so if that is the doctor that collects my eggs, do I have to be 100% going back to them? And the answer is no. You can always move your eggs. There are certain freezing transportation companies that will do that transfer to if you decide to do the IVF and the whole process later in life with another physician. So you do have the options. You're not completely stuck with that.
Wonderful. Good to know. Okay, so I'm going to open this up to a question in the audience. Has there been any research comparing the quality of eggs or sperm before and after interventions like NAD plus, IV, exosomes, or HRT specifically in the context of optimizing epigenetic factors? Are there any biomarkers or measurable improvements that indicate enhanced fertility potential post-intervention?
Yeah, not that there are that I know also NAD that have published specifically for fertility, exosomes right now. PRP is one of the biggest ones in regenerative medicine. And then what was the other one? HRT. So if you are in HRT, and just to disclose this is hormone replacement therapy. If you're in HRT, that means that you're already perimenopausal and that you already need a hormonal balance in. Therefore, you're going to get, if you are going through the process, hormones are going to be 100% applied to you, let's say, with every injection. You want those hormones to be at the peak so you can grow those eggs to the maximal potential. So if that's where the question was going, because you are getting hormonal replacement therapy through your fertility processing just so you can collect the eggs, and therefore also some physicians control those hormones as well if you're going for implantation. So that has been studied a lot. NAD and exosomes is not that I am aware. But let's touch on a subject that I didn't, which I think is one of the most important things. What are the things that you can do to optimize that we know that science have proven that you can do, right? So I'm going to quote Dr. Natalie Crawford. She says, a diet well planned for all of our cells, including our eggs and our sperm, is the best diet you can be on. So a very high dose of plants, eating plants, whole food, plant-based, not being 100% vegan or plant-based, but adding as many plants and whole foods as possible will ensure that your body, every single cell in your body, has the best chance. There are supplements as folic acid, but this is all of this conversation that you will have with your physicians, right? Folic acid and CoQ10, those are two supplements that are your physicians will be looking into, right? Sleep, having a correct sleep pattern, and the same as mobility and exercise. So it's funny that we go back to the things that we all should be doing, right? But most specifically, if you are trying to conceive or if you're trying to get ready. And hold on to yourself right now, because this is the most important one that I hope you all take, which is plastic, microplastic. Microplastic is already proven to be all over our body. And unfortunately, it's a hormone disruptor. It's an endocrine disruptor, meaning that our hormones are not being produced in the level they should. The receptors are being blocked, or they're mimicking our hormones. And therefore, we have to stop. So everything that is in a plastic bottle that can be in the heat and therefore leaks into the liquids that we're eating, warming things in the microwave in plastic. So start thinking on all of those things, not only for yourself, but again, let's go back, for our daughters, for our sons, There's microplastic found in sperm. There's microplastic found in placenta. There's microplastic recently found in the brain. So microplastic is one of our biggest things. They can be in the things that we're cleaning the house. So we have to, this is the new world that we have to start waking up to, more than NAD and all of the other things that, yes, they can help. Again, go to your physician and have this conversation with your physicians, but those are the things that we can definitely do and that are scientifically proven.
Right. Thank you. One last question. I know we're at the top of one, but I just want to get this one in. How long are eggs kept? How does disposal work? Can eggs be assigned or sold to someone else, i.e. surrogate? What about end of life planning? Can eggs be owned by a trust?
Mm.
Yeah, no, that's a good one. Well, how long? I mean, we recently had a successful pregnancy from an egg frozen in the early 90s. So, biologically, that child should be like closer to 40, 30, 35, but it was just born. So, this is all brand new medicine that's happening, right? And
Oh,
legislations are catching up to all of that. But you personally own, it is an object you own, right? As per today under our legislation, right? And therefore, you make the decision of keeping them, discarding them, or donating for science, or selling them to donors, or selling them selling them to donors, or donating them for science, right? After you've completed your family, or if you decide not to ever use them, so as I'm saying, they are viable if they're kept in the correct temperature. They are viable. We just proven that with this recent pregnancy, successful live birth of this kid. So and then can they be in the trust? That I am not a lawyer. That can be opened up for any of the legals. I would love to hear that answer. I'm going to take that note
sure.
and
I feel like it's
maybe
an asset, no?
it is yours. Is your asset. I always thought about, what if I kept that egg for my daughter if my daughter becomes infertile, for example. And yeah, that would be a great question to ask. I don't know the answer.
Amazing the things that just came up in my head on things I want to talk more
Hmm.
about, but we're at
But
the
this is interesting, Dr. Mitrani, because here in Spain, I'm talking about the situation in Spain. You can keep your eggs as long as you want, but I just want to add something. I guess in the US it's the same because you guys charge for everything more than here. We can keep them 10 years, and then longer than 10 years, you have to be paying every 5 years. So I mean, let's say it's included to 10 years, and then after 10 years here legally, you have to then write down that you want to keep them 5 years longer. And every time it's like a legal thing that is happening. So it's not like we keep them forever and nobody needs to know. We need to write that down every time, every after 10 years, so to
No,
say.
so here as well, you
And
you pay every year, and there's a certain amount of years that it's covered. I think it's 5 year, not 10. And don't quote me because I don't have that legality in there. But yes, you will continue to pay if you want them to continue to be stored.
but for us legally, if you keep them more than 10 years, it has to go through a legal process as well.
Yeah.
So that's also for us to consider when you freeze your eggs, that if you do it in your 20s, then you should want to have your child in your 30s. In a way, that's a thing that keeps it like between the age range. Legal purposes, again, we don't have the legal person here. And then there's what was I going to add to this? There was something else that you were saying as well. Well, I forget. Sorry.
this was an amazing conversation and discussion, right? I think a lot of people got a lot of value out of it and understand the importance of this journey itself, and thinking a little bit further along the way, and then now the ability to actually have some type of awareness to spread to other individuals, to your friends, your aunts, your sister, your your guy male friends, right? Even. And so it's not just women. This is part of us planning our family for the future and having the empowered life that we all want to have still, right? And so this is all part of it. So I really appreciate both of you, Yessica and Mari, for coming here and sharing your story and sharing your knowledge and your background and everything, just because this is, I can only imagine how many people this is going to help going downstream when, just by one person, just kind of spreading it and getting that conversation going. So thank you so much. Is there anything else that you want to share before we end the webinar?
Well, I'm going to add the nice part of the story.
Yes, please. No, I wasn't
I
sure.
mean, we're
I
talking
didn't
about all
want
these things and then, but there's a
I
fun
didn't
part to
want
the story.
to.
After I froze my eggs,
Yes.
and I got scared and I decided I have to go to the IVF. I got pregnant naturally. So I'm 42 years old and I'm pregnant. And all these old eggs and this whole story about me being so old, because again, let's add that to the equation. You're constantly hearing how old you are. This is something to keep in mind about how we deal with our age. But now hearing Dr. Mitrani about the secondary infertility, and I have a peace of mind because I didn't use my eggs yet. They're still there and they're available. So
Oh,
somehow
wonderful.
I'm feeling that what the only thing I want to share with this is having that is a peace of mind. And just for that reason, it's the best investment you can do, really.
That's right. That's right. Thank you so much, Jessica.
I agree.
Thank you,
Dr.
guys.
Matrani,
Okay.
anything you want to just finish off with?
No, thank you so much for the invitation and for opening up this time. Everybody that stayed and listened to this, I think we make a better world, a better community when we all share this information.
Wonderful.
Yes.
Thank you so much. Thank you, everyone. Have a great
Bye,
day.
everyone. Thank you.
Thank you.